Times are surreal. The headlines can be terrifying. Headlines such as 2 women fell sick from coronavirus, 1 survived, or Italy's coronavirus deaths are staggering, they may be more preview than anomaly, permeate the internet. Disease is a tragic reality of the human experience. As an example, despite our best medical advances, in 2019 alone, 650,000 people died from the flu and another 2.5 million from pneumonia all around the world. Now, before the good news, where do we currently stand with COVID-19? COVID-19 is a very serious pathogen. The consensus is that as many as 2/3 of the population is likely to become infected with the virus, and it has been declared a pandemic by the World Health Organization. The data, as of now, suggests that this is significantly worse than the flu, and it can be especially lethal to elderly individuals and those with underlying medical conditions. Currently, approximately 1,200 people have died from coronavirus in the United States, and that number is expected to rise significantly in the coming weeks. So, grim details aside, what are the reasons for hope? Number 1. 3 trials strongly suggest that a combination of a common malaria drug and a common antibiotic working synergistically can hasten recovery. The drugs are hydroxychloroquine and azithromycin, commonly known as Z-Pak. A trial in France showed that a combination of the two significantly reduced the viral load. More trials are currently underway. Number 2. We may develop a vaccine faster than anticipated. While a vaccine is still most likely months to a year out, they are currently testing vaccines in record time. In fact, new technologies and top minds around the world are solely focused on finding a solution. Supercomputer systems have been enlisted from Oak Ridge National Lab and IBM and other firms, cutting a list of 8,000 possible solutions down to just 77 in a few days. This work normally would have taken years. Number 3. The vast majority of people who contract the virus show little symptoms and fully recover. Given that if most people show no symptoms, it is in fact possible that many have had the illness and recovered, which would bring the death rate down significantly. Some have estimated that there are nearly 3 million cases in the US untested, and if the vast majority recover, the death rate may fall very well below 1%. Number 4. The US has weathered pandemics before and has recovered. In 2009, 60 million people contracted H1N1, known as the swine flu, in the United States, and approximately 12,000 people died. It primarily targeted small children. This has not been discussed much in recent years, but was a very significant concern at the time. Number 5. Walmart, Amazon, and Costco are hiring hundreds of thousands of people to fill new jobs. Uber cut their fees on Uber Eats just to help and get food to people who are stuck at home. Colleges have made expensive tuition courses free to people online. It seems the entire world is on board to do its part. While there are many reasons to be concerned, there are in fact many reasons to stay optimistic in our battle against COVID-19.